What's up, everybody? Welcome to the Dropping Wisdom of Santos podcast. And today I have a new guest. Please introduce yourself and tell us what it's going to be about today.
Hey everybody, my name is Brittany Bolt. I'm a patient care coordinator at Ideal Image in Virginia Beach. It's a great place to work, and yeah, let's jump into it.
Okay, patient care coordinator. What exactly does that mean? Or what is that?
That's a good question. We sometimes wear multiple hats. I'll say that in general. Each practice is different. Each medical group is different. But for the most part, is what I do. We're the first face you see when you walk into Ideal Image. And then what we also do is we help put together care plans, depending on, what our manager kind of assigns for that day. But yeah, we open, close, just kind of, I would say, besides the nurses, we make the place run, and then our manager makes sure, everything runs smoothly for the most part. But yeah, we answer calls, phone etiquette is key. There's emails, we give quotes to customers. I mean, the list goes on and on for sure.
Okay, do you need a certain type of education, certification, degrees, or anything?
No, but that's not always the case. There are some places where, depending on if it's a medical group that requires it, yeah, you might need your associates or something, or maybe some type of certificate. But unless you're not injecting, which in this case I don't, then yeah, no, you don't really need a degree to do it. But I mean, obviously a high school diploma. But
okay, yeah. Or GED.
Or GED. Yeah, respectfully.
Okay, so what exactly is your role? Are you the person? So are you medical and not dental? Does dental have them too? You just work on the medical clinic.
Correct.
Right.
Yeah.
Okay.
So medical and dental both have different types. But dental, it's always different. It could be a dental receptionist is what they're called usually. But with my role, it's a little bit different. It's kind of like, I would say, medical administration in general. But yeah, each job varies depending on the group essentially. But.
Okay. So, what makes a good patient coordinator?
You have to be a people person. You have to be a people person. You have to be congenial. You have to be, and genuinely enjoy it. I'm an extroverted introvert, so I love people. Especially when it's my biggest goal working in any job, not just this job, is happiness. I want to give people happiness if I possibly can, because then it's better care. But yeah, I would definitely say you have to be a people person, and you have to be open to not being judgmental and hearing people out with different things that they might share with you, because medical, sometimes in that realm, it can be a little bit personal. I mean, you find out things about people, you hear things about people, and you just kind of have to take it in stride and not show it on your face.
Well, see, people think I'm a people person, which I can have good social skills, but at the same time, I can't stand motherfuckers. And so, at that aspect, I'm very judgmental. Mm-hmm. If I meet someone, I can tell within 5-10 seconds I like him or not, or I don't like this dude, fuck this dude. I'm very judgmental. I don't care. I will judge someone real quick, and he'll know on my face if I don't like you.
Yeah.
And I would, having your job too, and certain person's medical background, medical record, after they leave, you're like, man, this motherfucker right here, boy, you see his medical record? I'll be talking mad shit. But that's just me. I don't know about you, if you're probably more professional than me, but I'll be like, if I seen something on this dude's medical record, I'm like, damn, this dude grinding.
I will say, this job, we don't really see too much juiciness. I would say more so when I used to work in an OBGYN office that's well known in the area. I'm not going to say the name because I don't want to.
That's fine.
I don't want to give anything up here, but when I worked there for a little, I think I want to say up to 3 years or something like that, because it was years ago. But that place had, the tea was hot. The tea was hot. You hear crazy baby names. You're like, oh really, Blaze Green? You want to name your child Blaze Green? That's a real name, by the way. That's a real reference. That's somebody named their child that. Oh yeah. You hear a lot of stuff, and then there was some scandalous stuff. There was maybe a commander's wife who, when he was on deployment, may or may not have miraculously conceived, and it was a whole situation for that person and that family. But yeah, there's definitely there's some tea. There's definitely some stuff you would not expect, but you just have to keep it private, because HIPAA is very important.
Yes, but at the same time, who doesn't love good tea?
Oh yeah, there's definitely some staff members, that will partake, including the physicians.
Oh yeah.
They'll come out of the room. I mean, there was at that practice specifically that I worked at, and yeah, there was some stories that were shared, or even years later, people would be like, "Do you remember so and so? Oh my God, do you remember that case that somebody came in and this and this and this?" And I was like, "Well, how could we forget?" You know?
Yeah. Wow. Okay, so in detail, this you walk into Ideal Image. Talk to us. What is your daily routine from when you walk in until when you leave? Tell us your whole daily routine. What everything that you do by step.
Sure.
In detail, please.
Sure. So basically, it depends on the shift. So if I'm opening shift, I come in, I open everything up with the nurses. We work together, and also it depends on if my manager's there. I mean, she's off on Saturdays typically, so it all changes who does what. But for the most part, it's pretty consistent. So yeah, if I'm opening, I would come in, I would help the nurses turn on the lights, turn on the TV, make sure all the marketing stuff looks good, make sure the coffee bar is stocked. Make sure that there's like water bottles, and then our care plans are ready to go for the nurses, and then what else? Obviously sign in my computer, and there's like a whole dashboard with like a bunch of different apps on there via Okta. And then check voicemails if there's voicemails that need to be checked, any notes that have to be followed up for that day from the day before or something, or check my emails for any new promos we might have, like flash sales or any kind of just any way to save you guys money. And then as far as closing shifts, pretty simple. I mean, it's just the opposite of opening, but a little bit different. There's just some things that make sure everything's put away, make sure the charts are put away in the chart room, and then we lock the chart room because of HIPAA, obviously, because we've cleaning people come in the building, so we don't want any sensitive stuff out. But besides that, yeah, just make sure all the lasers are off, all the rooms, like the lights are off and whatnot, the music. We have an interesting choice of music sometimes. We don't have any control of it, but it's pretty funny when we turn the music off, everybody just takes like a sigh of like relief that we don't have to sometimes listen to any more music we don't want to. But yeah, besides that, I mean.
Do you deal with medical insurance companies?
No, so this is the funny thing. Our medical group is a corporation, which a lot of them are, but specifically with ours, it's elective procedures. So we do not cover anything. We don't have to deal with insurance. That's a plus. So everything is, for the most part, like I said, since it's elective, we have two types of financing, and that's as far as our end goes. We don't have to do any claims or anything like that, so it's really nice.
Yeah, because I know on the dental side, from what I understand, it's a pain in the ass getting a hold of the insurance company and figuring out how much do they cover, how much does the patient owe, and all that. In the dentist, I'm saying that now because I just came from the dentist, so I was getting refreshed on the bullshit that you have to deal with. But okay, so you don't. How hard is it to schedule appointments? Does someone has certain medical issues? Do they take priority over someone else when it comes to scheduling?
No, absolutely not. We don't have any favorites or anything like that. It's pretty much whatever available appointments that we have, we will schedule for. But the tricky thing is that sometimes it depends on if people have a preference. If they're like, oh, I prefer this provider versus this provider, that injector versus this injector, then it makes it a challenge because, like everybody has different caseloads with patients. So that's just one little like gray area that we kind of just explain to the patients essentially, where we're like, hey, sorry, I mean, we want you to be with this person if you want this person, but if anything happens with their schedule or something changes, if you want the first available, we'll have to put you with somebody else.
So what is some Ideal Image? What are they injecting?
That's a good question. Because Ideal Image.
That's what I do on the Drop of Wisdom with Santos podcast. I ask good questions. That's what I do.
Totally fair. I hear you. So as far as what we do at Ideal Image is aesthetics, right? So that includes laser hair removal. We've got different types of facial. Not your run-of-the-mill facials, by the way. They're a little bit more invasive. I would say more chemical peels, microdermabrasion, stuff like that. All the girlies know what I'm talking about. The girlies are definitely going to understand that and be like, what?
I know what you're talking about.
I use a 3-in-1. What are you talking about? I'm just kidding, guys. Kind of. But yeah, but as far as that, let's see. With the laser hair removal, it's a little bit different than... Like, for example, we have some injectors, and then we have some practitioners that they don't inject at all. And when you're probably wondering what the heck are you injecting, good spirits, I'm just kidding. But no, we We inject Botox, filler, and
Lip filler?
Lip filler, face filler, but we typically stay away from off-market use. For the aesthetics people, they're gonna know what the heck that means. We are not gonna do tear trough injections. We're not gonna do like something crazy. Like, you'd be surprised. Anywhere on the face, there's some businesses around here that they inject everywhere.
Do you guys do PRP?
We do PRP. We do. Yep. Okay. Look at you.
I've had a lot of people on my podcast that did that.
That's cool.
Yeah,
No,
Karina Michelle in Norfolk does PRP. Very cosmetic.
Yes.
Yeah.
Yep. So we do stuff like that. We've got PRP, like microneedling, and then we also have broadband light, but it's also known as like IPL, and it's like intense pulse light or laser or something like that. And then we also do oil therapy. A lot of people don't know what that is, but
I don't either. What is that?
See, there you go. So there's multiple layers to the skin. Oil therapy goes down to the third layer, or this like between the third and second, depends on how deep the person wants it. But essentially, what it does is it like lifts the skin and it tightens it.
Oh, so like like the old women that got that turkey neck, they kind of tighten up the turkey neck.
Yes.
Okay.
Or if you just want your jaw snatched or something like that, you can go in and get that done. But there's different settings and there's different types of oil therapy treatments. There's also the one that's underneath the eye. That one's really good for people who they have like really deep wrinkles and like looser like bags somewhat.
Okay.
It just kind of pulls it up a little bit and then but it does it naturally. So you wouldn't have to do it with like filler or Botox or whatever. And it actually, once you get it done, even weeks after, it still like produces collagen in your skin, so it's very beneficial.
Being the fact that you're a patient care coordinator, are you looking into progressing and becoming an injector?
Actually, that's valid.
Because it sounds like you know a lot about it, so I figured, why not do it?
Like go for it, full.
I'm just asking. I don't know if it's, what do you try? Yeah, I mean.
That for a while I definitely thought about being maybe like a PA or an NP or something, but I feel like I don't know, I feel like for me injecting is something you take a risk. You do take a risk because everybody's body is different. Everybody is like a snowflake. They're all completely different. So there's some people that you might inject and they don't have any issues, right? Which is what we always hope for. But then sometimes it could be even human error, not the person who's injecting, okay? It could be the human error where like the post-care instructions, the person going home they laid on the wrong side, or they basically went against...
They're not following instructions.
Yes, they went against the instructions that we gave them. And so then what happens is you have this like person who's upset because this is the moneymaker, let's be real, you don't
Trust me, I know.
See?
I know.
See?
It's a gift and a curse. It is.
I feel you.
Honestly, I wouldn't give a fuck. I'll stick a motherfucker quick with a needle. I'll like, let's go. I'll inject someone so fast, I wouldn't care. Ain't me, but I got you. But I know people care. But go ahead, continue. Sorry.
No, you're fine. But yeah, but that's basically my issue with it, is that I would feel awful if somebody felt like it was my error in messing up their face or like maybe making a mistake or something.
But does a patient sign paperwork so you guys aren't held accountable?
Yes.
Okay, so
yes.
Really, who cares then? I wouldn't really care. But you were fine when you left. If something happens afterwards, you guys can figure out if it was you or if it was the patient.
Yep.
And if you still be friendly and try to help them out.
Absolutely.
Of course, but you guys are pretty much protected from a lawsuit because of certain paperwork they signed.
Yes.
Okay.
It's called a consent. There's different types of
consent forms.
Informed consent forms. It's like a redundant way of saying it, but all that paperwork that they sign, they're fully aware, but a lot of people don't read. A lot of people don't read the fine print, and they're like, oh, well, then you owe me this. Like, I don't like this filler. You're going to have to dissolve it, whatever. And that doesn't happen often, honestly. Like, for the most part, I would be confident in saying that 95% of our patients are, like, absolutely happy with everything, and the 5%, it happens, like human error, or people have unrealistic expectations maybe. A lot of women will come in, and they'll be like, oh, I want, like, only 20 units of Botox, but what they actually need to achieve the goals that they want in their face would be 50. You know what I mean? So it just depends. I mean, each person's different, and I would feel bad if somebody didn't get what they wanted out of it. Like, I would take it personal is what I'm saying. So, like, that's why I never went into, like, further with it. But I've definitely thought about Possibly getting back into clinical research. It just depends. It depends on like how things are gonna, pan out in the next 6 months.
So you're basically the liaison between the patient and the doctors,
Yes.
basically.
Mm-hmm.
And sometimes you're the messenger and you get kind of beat up sometimes.
Oh yeah.
By who? The doctor or the patient?
Never the practitioners. We're lucky at the place that I work at. We're very, very fortunate. We have some great staff, and I mean that all around. I'm not just saying that. I really, really enjoy these women. And it's all women. Otherwise, I'd say women and men. But yeah, it's all women.
It's okay. It's sexist. That's fine.
Sorry, guys. Jeez. But yeah, as far as like our place goes. No, not really like a staff issue. I would say we typically feel the brunt of the customers.
Yeah.
Because people pay good money and they want what they want, and so I understand their frustration. But sometimes, they shoot the messenger.
Yes, that's unfortunate because they know you're not the one that stuck them with the needle.
Exactly.
You're just the one that made the appointment.
Exactly.
Right. So it was like, hey, and he's in here. You want to talk to the doctor? She's over here.
Oh yeah, right.
Is that what you do?
Depends. It depends. If they're busy in between appointments, obviously I can't. But I will definitely take a note and tell them, hey, you know what? Take a seat in the lobby. Take a beat. Let me go grab that practitioner for you once they're free. And then I'll let them know, hey, so and so wants to talk to you about this or whatever. And then typically they'll follow up with them if they have the time. But sometimes if it's so busy that day and there's back to back patients, we don't want to put anybody else behind. So we'll just be like, hey, we'll give you a call, we'll follow up with you or something, depending on what it is. We would never dismiss like an actual, urgent thing.
Okay. Do you, what else do you do that we haven't mentioned?
Like at the job, oh man, there's a lot of notes. There's a lot of stuff, like we have to be up to date on like the treatments, what it entails, post-care instructions, stuff like that. If patients have any questions that's medical, we always have to, refer to the doctor or refer to the nurses, just because we don't want to tell anybody medical advice that's not like a gospel, like what they say.
Especially if you don't know someone has certain type of allergies as well, right?
Exactly.
Yeah.
Yep. There's that, but then there's also too, not just the allergies, but sometimes people have different like cofactors, like comorbidities. Like there's different things that they might have, like some kind of disorder, that it's in their chart and the nurse knows about it. But let's say I don't have the chart in front of me, I'm not going to know that person has like Graves' disease or something. Yeah. You know what I mean? So you have to be careful with what you say.
Okay, and plus in that field of what you guys do, shit's always changing, always updating. So there's always new things coming out.
Yep.
So I mean it's always something learning, and plus they always want to have the latest and greatest equipment as well. So I could assume it could be a pain in the ass sometimes to even though it's cool, but those things aren't cheap. The equipment's not cheap.
No.
Okay, so how does someone become a patient care coordinator? They just how do they become one? And what advice do you have for someone that's interested in being one?
Yeah, I feel like a lot of places are by referral now. So if you know someone to get into a lot of these places and you have the skill sets, I think the skill sets in general would be like, are you a people person? Can you get along and work as a team, but also be self-motivated? Because there are some times when like you're gonna need to come in and handle a situation when my manager's not there or something like that, or whoever's the administrator of the office or something. I think somebody who's diplomatic, somebody who, I think it just depends on like who you know and skill sets. Honestly, it really depends. Like, are you tech savvy? Do you know how to turn on a computer? Like simple things. Do you know how to like quickly learn things with training? Because, for example, at our company, we don't use an EMR per se. We use Okta on the dashboard, and then we use Salesforce. But there's some like places around here, like doctors' offices or other aesthetics offices, they use completely different systems. They might use like Epic or Athena or there's like a number of EMRs, but it just depends on how quickly.
What does EMR mean?
A medical it's electronic medical records.
Okay.
So and some people have physical records. Like we're kind of a hybrid. We haven't migrated all of our charts, some of the physical ones, into the system yet. So we have to pull charts sometimes, and there's a lot of people, they don't have to do that. They can literally just pull up everything on my chart now, or on Epic, like I said, or Athena. And I'm sure there's a number of other ones out there, but I don't know about any other ones locally. But yeah, so I think it just depends.
What benefits do you have being a patient care coordinator? Do you have any type of employee discount, like 20% off Botox and shit, or what?
Yes. So
well, there you go.
Yeah. There's a 25% off. But I feel like I'm the outlier at the practice. I haven't had anything done there.
Not yet.
So not yet. That's so funny. That's so funny. I mean, they've offered me so many times. They were like, "Hey, do you want your lips done?" I'm like, "Nah." They're like, "Oh, do you want Botox?" I'm like, "Nah." They're like, "Oh, do you want this?" And I'm like, "Mm-mm." And like they offer me cool sculpting. Oh, that's another thing we have.
Hey, what's that?
Cool sculpting and cool tone. Cool tone is like if you have an area that's just you hit the gym as much as you can and it just won't be toned and you want those like abs or you want your butt like just lifted up like or if you want your thighs a little bit tighter, you can come in and get there to us and then get cool tone and if we just set you up and it's like these little sticky pads kind of and it's electrolysis somewhat but it stimulates it's like doing 1,000 crunches but in like one treatment.
What?
It's insane.
So you can get rid of my muffin top.
There you go. Yeah. But
wow.
But if it's actually grabbable, right now that's like if it's actually grabbable, cool tone. Cool tone is the bomb. Like that is like the bomb.com. So they freeze.
Like cryotherapy or something?
Somewhat, kind of. You're close. So basically, what they do is we put these attachments on, right? Like let's say that you wanted your abdomen, right? We put 2 attachments on the abs. You come in for like 3.5 hours, 4 hours. We'd be besties. It's cool. You can bring an iPad and hang out. But anyways, it freezes the fat cells and it kills them permanently. So then what happens is like anything that you have, any kind of like skin here that you can grab, it's gone.
Like it wouldn't be flabby.
No.
Wouldn't be nothing hanging.
Nope.
It'd just be tight.
Yep.
Does it hurt?
I mean, from what I've heard from patients and stuff, it just depends on your pain tolerance. But no, I mean, because it numbs it. It's literally it freezes it. So you might have like the initial
That's bananas.
I know it's like space age stuff, guys. It's really cool. But it's one of those things where when you put the attachments on.
And what's it called?
Cool Sculpt. Why am I blanking?
Cool Sculpt?
Cool Sculpt. Yep.
That's bananas. I'm too old for that. If I was half my age, I would look into it. But now I'm like, I don't give a fuck now. But I'm like, damn, that's crazy how someone doesn't even have to go to the gym.
It's wild.
They can just try to look like that.
Yep. There's some before and afters that we've seen, and like typically with men, it's like as you know, you're like men. Most of them are apples, so like being apple shaped, you carry all the way here. So what some of our patients have done, which we have a pretty decent amount of males that come in, you believe it or not, and they'll come in and they'll get their abs done, and they'll do the cool tone, and they're snatched, and then they're like, well, now I want to tone, but like I don't have as much time to go to the gym as much. But I'll come in for like, because the cool tone treatments are way shorter than like the cool sculpting.
How much did it cost, if you don't mind me asking?
No, I don't mind at all. It depends on what specials we have, because we do have specials a lot. But we sell them in cycles. So it's not like sessions, it's cycles. I don't know why they say that, but they do. But yeah, I mean, I would say I would have to have the paperwork in front of me to quote each area. But I'll give you a ballpark estimate.
Yeah, that's fine.
So if you were like, oh, I want 2 treatments for my abdomen or something, it would be, I want to say like 2,500, 2,400, 2,500. However, we do have sales all the time. And then the other thing is too, we also have, what is it? Why am I blanking on this right now? Santos, help me.
Well, it's a good thing to I think it's worth it to individuals that, let's say, they're models and stuff, and they're trying to still maintain their profession. Mm-hmm. It's quick to do that, and not because they're too busy to maintain their model body to get that, and done to their body.
Right.
Right. Basically.
Mm-hmm.
Well, damn, that's good to know. That's crazy.
Oh yeah, it's great. To mention what I was gonna circle back around the financing. That's why we offer 2 types of financing. We've got one type of financing that's like a soft pull, and then the other type of financing, if anybody's heard of Afterpay or Klarna, you can use that, and it's like interest free, and usually it's 16 payments that they set it up, and then you do like a small down payment, and then
Wow.
Mm-hmm.
Okay. So is it? You think we covered everything with what you do?
I feel like, yeah. I mean, I would say majority of it is like a lot of interaction with people, like logging their alley points, and taking payments, like just regular transactional stuff that it happens in the daily life of a business.
All right, so are you ready for the Santos signature questions?
Well, let's hear it.
All right. Do you think you've ever witnessed paranormal activity? Think you ever seen a ghost?
Ooh, I like this question.
And if it was, if you have, tell us the one that sticks out the most.
Oh my God, I would definitely say hands down my grandma's house.
What
Grandma's
happened?
house is well, it's in Michigan, so guys, don't worry, it's not around here. But yeah, oh man, I want to say like before she passed away, things really got like everybody in our entire family always thought there was weird stuff, like especially in the basement, like breathing, your hair would be moving, like covers would be pulled. I mean, it was like really bizarre stuff. But I would say when she passed away, it was spooky. It was definitely spooky. There was some things that I saw, a lot of weird dreams. But the biggest thing that the one thing that sticks out one time was I was walking over to my grandma because she was in hospice at the time. So sorry, a little bit of a sad story here. But she was in her recliner and it was like 3 o'clock in the morning. She had really bad insomnia at that point. And she was like, she turned and looked down the hallway and she was like, son, and my uncle has long since been passed away at that point. And I was like, what? So I got up and I walked over to her and I was scared to look down the hallway. You know what I mean? But I did it anyway because I'm crazy, I guess, like that. And I looked down the hallway and I see like, it looked like my uncle, but it was like staticky. It was like a gray static. I don't
Like but you seen his silhouette?
Yeah. And it kind of looked like his face, but
Wow.
But it wasn't. And so then when it went, whatever it was, because I don't know how to explain that stuff, but it went from the bathroom into his old bedroom, and it looked right at me like that, and like slowly, and I was like, oh, and I went back behind the wall and away from the hallway then, and I was like, Grandma, this is like, okay, I must be really tired. And I was trying to find logic in it. I'm like, okay, I'm just exhausted, or like maybe I'm just stressed because my grandma's sick and whatever, and it was scary.
Did you get
really
cold?
scary.
Any goosebumps? Did you smell anything?
Oh, I absolutely got goosebumps and I got a nosebleed actually. But
What?
But I think, to be fair, I think that was because your blood pressure goes up. So I'm always going to try to find the logic in it. So it could have been, I don't know. It's unexplainable, but I definitely got a
Wow,
nosebleed.
that's bananas.
Yeah, it was nuts.
That's a pretty cool story.
It was wild. There's a few more in that house, but that one's the best one that sticks out probably.
Okay. Wow, that's crazy.
It was nuts.
I'll always be scared to look down the. Did you ever go?
Oh my God!
Back in that house again?
Every light was on. Every light. It was like the kukui was in the back bedroom. It
Holy
was
moly!
So scary.
Okay, one more question.
Mm-hmm.
Do you think you've ever witnessed or seen a UFO alien?
No.
Okay.
And I think maybe that's a half answer, I guess. Okay, again in Michigan. This was out in Newport News. If anybody knows where that's at, you're welcome.
In Michigan, not Newport News, Virginia.
Nope, yeah, Michigan. They have a Newport News in Michigan as well.
Okay,
I know,
okay.
So weird.
No
It's
confusion.
So weird.
Okay.
No confusion. You. Sorry, guys. The myth. This one. But yeah, there was. I think it could have been that. Mind you, there was a base nearby. So I think again, logic is that there may have been some kind of It didn't look like a jet. It didn't sound like a jet. I've seen jets here. I've heard jets here. It was at night and it was bright green with a bluish hue somewhat. And it just went and boom and it was gone. And I'm like, what the hell was that? So I don't know if it could have been, who knows? Maybe they were doing some kind of experiments or something with flight, or I don't think it was flight though. I think it was maybe energy stuff. I have no idea. But
wow.
it was different. It was definitely different.
That's crazy.
Yeah.
So you're thinking that could have been possibly a Tic Tac spaceship UFO?
But that's what I mean. I'm not sure if it was my gut instinct wasn't telling me that it was a UFO. It was more the military's doing some fruity stuff. What's going on?
Yeah.
But could have been. I don't know.
Yeah.
Mm-hmm.
Well, all right. Well, thank you for being a guest.
Yeah, thank you for having me.
Yeah, of course. All right, guys. Well, thank you for listening. And if you can, please follow me on YouTube, X, TikTok, Instagram, Facebook. I'm on Spotify, Amazon Music, and Apple Podcasts, and many others. And hope you enjoy the podcast. And I'll talk to you guys next time.